Hello, class, and welcome back to the second part of our lecture on psychotherapy, talk therapy. The approach that I want to look at now is cognitive behavioral therapy, also known as CBT. Now, it is a type of psychotherapy that focuses on identifying and changing negative thought patterns and behaviors that contribute to mental health problems. And I hope you see right off the bat, based upon our previous lecture on affective disorders, that this is the ideal psychotherapeutic treatment for dealing with anxiety and depression. Now, CBT is based on the idea that how we think about situations and events in our lives can affect our emotions and, by extension, our behaviors. And it is a relatively new form of therapy that emerged in the mid-20th century, in the 1960s, and was developed as a response to the limitations of other psychotherapeutic approaches, particularly psychoanalysis and behaviorism. Now, one of the pioneers of CBT was the American psychiatrist Aaron Beck. In the 1960s, Beck was working with depressed patients and observed that their thought processes often involved negative self-talk and distorted beliefs about themselves and the world around them. And he began to develop a new form of psychotherapy that focused on helping patients identify and challenge their negative thought patterns. Now, around the same time, Albert Ellis, another American psychologist, was developing a similar approach known as rational emotive therapy, or rational emotive behavioral therapy, REBT. And Ellis believed that emotional and behavioral problems were caused by irrational beliefs and developed a method for helping clients change their beliefs to improve their emotional well-being. Now, CBT, as we know it today, emerged in the 1970s as a result of the work of several researchers and clinicians. But two of the most notable being Beck and Ellis. Now, one of these pioneers that also contributed was a British psychologist and cognitive therapist, Judith Beck, and who further developed the theory and practice of CBT and created a manualized treatment program called Cognitive Therapy Treatment Manual for Depressed and Suicidal Patients. Now, since then, CBT has become one of the most widely used and researched forms of psychotherapy, and it's been shown to be effective in treating a wide range of mental health conditions, but most notably with things like depression and anxiety and other affective disorders like post-traumatic stress disorder, as well as substance use disorders. Now, overall, the development of CBT was a response to the limitations of psychoanalysis and behaviorism, which did not adequately address the role of thoughts and beliefs in mental health. So the work of Beck and Ellis and others paved the way for a more targeted, more streamlined, shorter timeline, effective form of therapy that has helped countless of people. Now, just a little bit of a difference here. Psychoanalytic psychotherapy will typically go on for years. Typical cognitive behavioral therapy typically goes for 15 to 20 sessions. So a typical cognitive behavioral therapy session involves the therapist working collaboratively with the client to identify the negative patterns of thinking and behavior that are causing the problems. And the therapist will use a variety of techniques to help the client change these patterns with the goal of improving their mood and overall well-being. Now, one common technique used in CBT is called cognitive restructuring, which involves helping the client identify and change negative thoughts and beliefs that are contributing to their problems. For example, if a client is struggling with depression and tends to think that they are worthless and a failure, the therapist might help them identify evidence that contradicts these beliefs and help them develop a more balanced and realistic ways of thinking. Another technique used in CBT is behavioral activation, which involves helping clients identify and engage in activities that they enjoy and find rewarding, even if they don't feel like it at first. And this can help to counteract the negative effects of depression and other mood disorders and can lead to an overall improvement in mood and well-being. So CBT is a very focused, short-term approach to mental health conditions that are particularly effective in depression and anxiety disorders and post-traumatic stress disorders and other affective disorders in that whole range, something known as obsessive compulsive disorder. It can also be helpful in eating disorders. So there's a wide range of ways that this can be helpful. And indeed, if you become an expert in cognitive behavioral therapy, you can easily have a full clientele of people that you can help. So, of course, like any psychotherapy, oftentimes it's good to work with a physician to ensure that the client also has a good combination. So you have a combination of medications as well as psychotherapy. And I hope that you find that this is something that you can always keep in the back of your mind, no matter how you're working with and helping people. When you see someone struggling, be mindful that CBT might be a place to help, particularly if you notice that a person is talking very negatively, particularly about themselves. And let's go on to humanistic psychotherapy now. So humanistic psychotherapy is a therapeutic approach that really emphasizes the individual's unique potential for personal growth and self-actualization. And so it focuses on understanding the client's subjective experience. So rather than being directive like psychoanalysis, this lets the client take the lead. It's focused on exploring the client's self-concept and their current ways of experiencing themselves and others and the world around them. Humanistic psychotherapy emphasizes the importance of empathy, of unconditional positive regard, and authenticity in the therapeutic relationship. Humanistic psychotherapy is something that emerged in the 1950s and 60s as a response to the dominant psychoanalytic and behavioral approaches to psychotherapy. And the pioneers of humanistic psychotherapy include Carl Rogers, Abraham Maslow, and Rollo May. Now, Carl Rogers was a prominent figure in the development of humanistic psychotherapy. He believed that individuals have a natural tendency towards growth and that therapy should focus on creating a safe and supportive environment that allows for self-exploration and self-discovery. Rogers also emphasized the importance of the therapeutic relationship and that the therapist's ability to provide unconditional positive regard and empathy and congruence was essential. There's also Abraham Maslow, who was another influential figure in the development of humanistic psychotherapy. Maslow proposed a hierarchy of needs that individuals must fulfill before they can reach self-actualization. And he believed that therapy should focus on helping individuals fulfill these basic needs, such as safety and security, and then moving towards their self-actualization. And then there's also Rollo May, who was a psychologist and existential philosopher who contributed to the whole development of humanistic psychotherapy. He believed that individuals must confront their fears and anxieties in order to achieve personal growth and self-actualization. Now, Rollo May emphasized the importance of choice and responsibility in the therapeutic relationship. Humanistic psychotherapy, then, is used to treat a wide range of issues, including anxiety, depression, as well as more everyday issues like relationship problems, like struggling with a feeling of being inadequate in some way. So it is particularly helpful for those that are seeking personal growth and self-discovery and improvement of their lives, and to find greater satisfaction within their lives. So a typical humanistic psychotherapy session involves the therapist providing a non-judgmental, a positive, empathetic environment in which the client can explore their inner experiences and feelings. The therapist may use techniques such as reflective listening, open-ended questions, and clarification to help the client gain insight and understanding into their thoughts and emotions. So in conclusion, humanistic psychotherapy is a therapeutic approach that emphasizes the individual's unique potential for personal growth and self-actualization. See, it's something that emerged in response to the dominant psychoanalytic and behavioral approaches that were very directive at the time, and influential figures like Carl Rogers, Abraham Maslow, Rollo May certainly played their part. Now, I want to focus in on, particularly on a certain type of humanistic psychotherapy known as client-centered therapy. Now, within client-centered therapy, it's a therapy where the therapist creates a supportive and non-judgmental environment where the client feels safe to express their thoughts and feelings and experiences. And I think you'd be surprised at how often a person does not actually feel safe to share their true self. And in so doing, there's a lot of stress and anxiety in a person's life. And if you do create a space, you will be surprised at the depth of complexity and struggle that a person has. In fact, I would argue that most people do not understand themselves or other people because they've never been in a space where they feel actually safe to express their thoughts, feelings, and experiences. So when you encourage a client to do so without judgment, you discover that a client will be able to understand themselves better and to work toward their own conclusions and their own solutions. So a typical session of client-centered therapy involves the therapist actively listening to the client and reflecting back what they're hearing. They are being a sounding board, a safe, non-judgmental sounding board. And this allows the client to feel heard, to feel understood, to understand themselves better, and to feel empowered. The therapist may ask some open-ended questions, and that helps to encourage the client to feel that they should explore their feelings more and experience their experiences deeper. And one of the main benefits of client-centered therapy is that it helps the client feel more in control of their lives. Now, by providing a safe space for clients to express themselves and to explore their thoughts and feelings, the client-centered therapy can help clients gain insight into their own motivations and behaviors. And this can lead to greater self-awareness and the ability to make positive changes in their lives. Now, another benefit of client-centered therapy is that it can help clients build stronger relationships with others. Because by learning to express themselves more effectively and by developing a greater sense of empathy for others, clients can develop stronger and more fulfilling relationships with their friends, their family, and their coworkers. And it's a bit of a side benefit in that as they learn from the therapist how to communicate and how to create a safe space for others, they can then use those skills later on in their own outside relationships. So there's a lot of benefit in personal growth and in self-discovery within humanistic psychotherapy, which is of great value in any situation, whether a person is suffering from a diagnosable mental illness or not. So what have we explored within this lecture? Well, we've explored three major types of psychotherapy: psychoanalytic therapy, cognitive behavioral therapy, and humanistic therapy. And each of these approaches offers a unique perspective on how to treat mental health disorders, as well as how to promote well-being within people. Psychoanalysis, developed by Sigmund Freud, emphasizes the exploration of the unconscious mind to gain insights into one's behavior and mental health. Here, some techniques are using things like free association and dream analysis, and those are integral to the psychoanalytic process. Now, while psychoanalytic therapy is not widely practiced today, it is in some circles, but other things have taken over, it still holds an important role in certain areas and is irreplaceable as far as its historical impact. Then there's cognitive behavioral therapy, developed by people like Beck and Ellis, that presents a present-focused, goal-oriented, focused short-term therapy designed to change negative thoughts and behaviors. And it's particularly effective with post-traumatic stress disorder, depression, anxiety, panic, phobias, that sort of thing. And it really involves cognitive restructuring in order to help a person. Then there's humanistic therapy. People like Carl Rogers and Abraham Maslow. Rogers, particularly known for client-centered therapy, is a humanistic therapy that involves creating a non-judgmental and supportive environment that encourages self-exploration and personal growth. Now, overall, while each of these types of therapy has its own unique approach, they do share a common goal of promoting well-being and improving mental health. And these talking therapies can be powerful tools for anyone struggling with figuring out how to be successful in their life, whether they're struggling from mental health issues or they're struggling to find avenues of personal growth. So I encourage all of you to continue to explore the world of psychotherapy and to find a therapy that resonates with you, whether it be psychoanalytic therapy, CBT therapy, or some other type of psychotherapy that might be available. There are lots of different types, and I encourage you to use them, to explore them, to engage with them, because it helps people to be courageous and to take steps towards living a more fulfilling life. I hope you enjoyed this lecture. You take care. Goodbye.